Okay, so we're going to move on to identifying signs of use. And so looking at the slide, the therapist is going to help caregivers to identify and monitor for observable signs of use, conduct random searches, the house, the yard, backpacks, bedrooms, any place that the parent feels like the youth might potentially keep substances, or extra cash or paraphernalia or anything like that. And then implement regular urinalysis or any other objective monitoring of use, such as breath scans for alcohol use. So as we're identifying these signs of use, these increased monitoring steps can potentially lead to parent-child conflict or a sense of feeling overwhelmed by the caregiver because this may be pretty new to them. So when we're implementing some of these strategies, it's going to be really important for you as a therapist to work pretty closely with the caregivers to predict and plan for any barriers that may arise, and then utilize social supports where needed. So for example, if there is going to be some conflict, we want to make sure that the parent has some safety plan attached to this or is using supports to make sure that we can help alleviate some of that conflict. We want to obtain objective evidence of use, like I said, which can help caregivers sidestep any unnecessary conflict. So using things like urinalysis or breath scans potentially could help to alleviate some of the conflict because you're getting kind of that definitive answer from the screen, the drug screen. Coaching caregivers through the guidelines of effective drug testing at home is going to be an important intervention step in most cases. If another agency is already requiring drug testing of the youth, we want to try to shift the responsibility of that drug testing to the parent to be monitoring it. By the parent doing this type of monitoring, it's really going to offer the best means of ensuring that we have sustained change. Because again, we want to keep the parent in the lead around all of these interventions. While urinalysis and other means of biological testing is common in terms of objective substance use monitoring in MST, it is not a required intervention. And it's not an intervention that's suitable for every MST youth or family. We really want to look at drug testing as a parent or a family intervention versus an MST intervention. So we really want to think about increasing the family's responsibility, so principle 3, as well as sustained change, principle 9. So it's going to be really important as a therapist that you are not seen as the authority or the person enforcing that drug testing is going to be done by the youth or the parent. We want to keep the parents, caregivers in the lead as much as possible around implementing any at-home drug and alcohol testing. Does that make sense? So again, essentially, we don't want parents and kids, more importantly, to see us as the heavy. We want the parents to be able to take the lead and be able to tell the youth that they're the ones that want to do the substance abuse testing versus it's the MST therapist that's now coming into the home and requiring that the family is doing the testing. Again, more increasing responsibility for the caregivers, and it really puts the caregivers in position for that long-term sustained change. In terms of the drug testing, again, what we're going to do is really review in advance with the caregiver all of the steps that would be involved in doing the drug testing. We should have the materials available to them so that we can help them practice to be ready when it comes time to do the drug testing. Doing this is really going to help them to increase their competence and their confidence in being able to implement the drug testing materials which can then decrease the likelihood of any conflict between the parent and the child, and of course increase the likelihood of success. Any questions? Okay, great. So let's talk a little bit now about the drug testing. So drug testing provides caregivers with a reliable and valid measure of substance use. Youth report can often be unreliable. Even the most well-intentioned youth may not be honest and truthful about their substance use. They may not tell you how often they're using, where they're using, when they're using, or if they even used at all. No matter how heartfelt their verbal report might seem. The other thing, too, is that reliance on verbal reports can often really set the youth up for failure, causing them to lie, and really lead to caregiver and youth feelings of disappointment and even conflict, and we want to avoid that. Verification is going to be needed in order to provide rewards which compete with the existing reinforcement of the use. So the behavior plans that we develop are based on contingencies, which are meant to increase incentives for abstinence or reduced use by the youth. So providing rewards without having that objective measure of the youth's substance use can potentially undermine the integrity of the behavior plan. So, for example, if you're relying on the youth's report and you don't have any objective monitoring or measure, the youth may say, "Oh yeah, I didn't use this week," and then the parent can give them the reward. Well, without that objective measure, we're not really sure if the youth has used or not, and could potentially be giving them that reward without them really earning it, which really undermines, again, the integrity of the behavior plan. More importantly, it's also going to be insufficient to compete with the existing contingencies for substance use, such as the feeling that the youth gets from the use and any positive peer attention. So we really want to make sure that we're using that objective monitoring or measuring along with our behavior plans. And then the last point on the slide talks about objective monitoring and clean screens equals increased trust and positive parent-child bond. So adolescents often report that a positive affective bond with their parents is the big reason that they stay away from drug use. Any questions about that? All right, great. So moving on to the next slide, talking more about drug testing protocols. So the therapist is going to introduce both to the caregiver and the youth and provide the drug testing protocols and provide rationale for it. Providing adequate information and rationale for the drug testing is really going to help to increase caregiver and youth engagement and alignment in the drug testing. It can be used as a means the drug testing can be used as a means to establish a baseline or provide evidence that a problem exists. And the drug testing should only be done when structured rewards and consequences are tied to the results. So again, the behavior plan is going to be a big piece of the drug testing. So you really want to make sure that some form of a behavior plan is established and in place before you begin the drug testing protocols. Especially for first time tests or baseline tests, which might be positive, it can be really helpful to plan out with the caregiver what that might look like so that the youth is not feeling punished just for participating. So this might be a rare occurrence where none or very little punishment is applied for that first drug screen. Does that make sense? Anybody have any questions about that? Okay, great. You may also set it up so that the youth can earn a small reward just for participating in the drug test itself without complaint, even when they're going to receive a punishment if they test dirty. This really helps the caregivers separate the behaviors and maintain a more positive focus. So giving them some small reward just for taking the test, even though they might test dirty and they're going to get that punishment as well. So again, rewarding them for complying with the test, but still receiving that consequence for testing dirty. And I think, it really does help the parents to see and differentiate between the behaviors. And so throughout the process of using drug testing protocols, the caregivers should really be encouraged to check with the therapist as frequently as needed, asking questions about whether it's a good time to test, potentially how to use the behavior plan, if they have questions about the test. So making sure that the caregivers are really aware that they can use that support from you guys whenever it's needed. Any questions? Okay. So lastly, when we're talking about identifying signs of use and drug testing protocols here, the therapist and the caregiver will jointly develop a plan for frequency of testing, develop consequences for the youth's refusal or inability to provide, and the therapist can help the caregiver practice until they feel prepared to use the tests. So as I said earlier, you're going to really review in advance with the caregiver all of the steps that are involved in doing a drug test. You are going to practice using the materials with them until they feel very comfortable, because it's going to increase the likelihood, it's going to increase their competence and their confidence, and it's going to increase the likelihood of success for them and decrease the parent-child conflict potentially. We really want to make sure that caregivers are aware that we don't want to tell the youth when they're going to be tested. We can kind of give them a ballpark of, it might be, a week or 2 weeks, but we don't want the kids to know the exact day. So the test is going to be most effective when it's random, when it's unexpected, and it's done within 24 hours of a high-risk time. And what I mean when I say that is that potentially if the youth is going out into the community or doing some kind of an activity where they may have some opportunity to use and maybe you can't control for everything, within a 24-hour period of that might be the best time to give the youth the drug screen. And then drug and alcohol the drug screens and the alcohol breath scans can be administered at the same time. Any questions? I think the last thing that I would say is that, if the youth is not able to provide the drug screen, talking to the parents about potentially that being seen as a positive drug screen.